If you're an aged care or NDIS provider, this is for you. A lot of providers don't have a clear handle on how to get more value out of the technology that they have in place already. Things like Microsoft Office or Google Docs. So what happens? Paper notes everywhere. Files in different places across different accounts and different logins. Case notes living in 10 different places.
Dogs and cats living together, mass hysteria.
And even when you do capture information, it's hard to find, hard to trust, and hard to use. In 2026, we're going to be speaking to providers about practical technology, setting up simple systems, and getting the most for their organizations with the technology they have in place. Not every provider is ready for a subscription platform. Platforms like Family Member Care, which we built, or others like Nightingale, Shift Care, or Brevity, they all have their pros and cons, but they all also have ongoing subscription costs. For providers who aren't ready for that step, we built something really simple. An NDIS and Aged Care Provider Kit. It uses the tools you already know, like Office and Google Docs. It gives you an organized way to structure participant information, contacts, case notes, and documents. It also includes forms to organize part of your intake, a process that all providers enjoy, I'm told. It's not a replacement for a full subscription-based platform, but it allows you to take a small step that reduces your admin time, reduces your risk, and most importantly, has no ongoing costs. It also comes with practical guides and checklists, a guide to securing participant data, a guide to AI and automations, the magical buzzword of the day. We cover the myths and the reality of that. Check out the provider kit in the link to see more details and stay up to date.